We actually go over, like, that's sometimes part of my sessions, like, okay, what is it within your budget? What can we do? Where can we go that may have some type of clothes like this? One of my favorite things I
Right.
either go to Shein, Hall.
Welcome to another episode of You Grow Girl podcast. I'm your host, Stacy C. I hope that you have all enjoyed the last episode on K-pop. I want to talk to you today about two important issues that affects numerous amount of people: lymphedema and the pelvic floor. These two topics are two completely different, but there is one professional that I invited today to help you with the treatment of these medical conditions. Have you ever heard of lymphedema? Have you ever heard of your pelvic floor? Well, today I invited a professional to have this important conversation. Dr. Tiana Polite Brown is a passionate occupational therapist with the love for advocacy and client-centered care. She holds a bachelor's in exercise physiology from the University of South Carolina, a master's in occupational therapy from the University of North Dakota, and a doctorate of occupational therapy from Creighton University. Dr.
All right.
Polite Brown is a lymphedema and LANA certified therapist, a certified women's health specialist, and a pelvic health specialist. She brings extensive experience across the lifespan, including adult, geriatric, pediatric, and adolescent populations. Clinical expertise includes lymphedema management, pelvic floor rehabilitation, cognitive behavior therapy, and dry needling. She currently practices in outpatient therapy and then serves as a faculty instructor with the Academy of Lymphatic Studies. In her downtime, Dr. Polite Brown enjoys spending time with her family, especially her husband, Myron Brown, and diving into her comic book collection, Batman, who remains her favorite superhero. While her long-term ambition is to advance the OT profession through client-centered care, her immediate goal is to become an OT clinical researcher. Please join me in welcoming my guest, Dr. Tiana Polite Brown, to the show. Welcome to
Hello,
the show.
everyone. Happy to be here. What up, Stacy C?
Hello. Thank you for coming. I appreciate it.
Yes,
All right, we're going to get into
happy to be here.
lymphedema basics. Can
You're
you
fine.
explain a simple explanation of lymphedema and lymphatic system?
Yes. So the lymphatic system is considered to be an open system that runs along the closed system, which is our circulatory system. And so it is, when we talk about the lymphatic system, it's kind of known as the body's trash can. It can take everything that's been deposited or that are in the tissues and take it out and through the system and supposed to be excreted out through your bowel and through your urine. But with the lymph fluid, whenever there is lymphedema occurring, which is an abnormal buildup of that fluid, and lymph fluid is considered to be a protein-rich fluid. And so it kind of sits and settles in the tissue. It doesn't move like water, but it also moves with water. And so that's why whenever a person has lymphedema, when they have swelling that they just can't get rid of, they tried diuretics, they tried exercises, they tried to lose weight, the one area of the body always seems to be larger than the other. That is where lymphedema usually is sitting and settling in the tissues and causing vascular issues, causing venous insufficiency, and just a overall heaviness of the limb. And lymphedema can be in any of the places in the body, but for the most part, for what I see, lymphedema affects the upper and lower extremity and the breast and axillary area, meaning the armpit. That usually happens with my patients that unfortunately had breast cancer and then had surgery and chemotherapy and radiation to the area when it comes to that particular part of the body. And so with lymphedema, it is a chronic condition, but it is manageable with the correct massage we call MLD, manual lymphatic drainage, using the right compression. Some medications can help, some anti-inflammatories. There's that can help. Diuretics are actually a no-no when it comes to lymphedema. It actually makes it worse because it takes away the fluid, it takes away the water out of the system and pulls it away, which makes the lymph fluid, which is a protein-rich fluid, heavier and dissipating through the tissues. So it's a little bit probably a over explanation of lymphedema, but that is kind of the spiel that I give to my patients whenever they come and see me, and depending on their their medical history. Sometimes you're born with lymphedema. Unfortunately, you are born with faulty lymphatic system that doesn't pump properly throughout the body, and sometimes it can be acquired, what you call secondary lymphedema, through surgery, through some type of trauma to the skin. Sometimes it could be acquired through different conditions like diabetes, venous insufficiency, things like that, thyroid issues, hormone imbalances. And so there are multiple ways that unfortunately you can acquire lymphedema, but you can live with it, but you can also manage it as well with the proper education and management of care.
Oh, okay. That actually was my next follow-up question, like, is lymphedema something that develops suddenly or build over time? But you just answered it because you said that people can be born
Mhm.
with it or it can come from, like, trauma from a surgery or
Yeah,
having cancer or things.
usually cancer.
Okay.
Yes, ma'am.
Are there common triggers that can cause someone's first flare-up?
So yeah, so usually, especially when we talk about women, the lymphedema can affect anybody, but women are more commonly impacted because of the hormonal changes. And so estrogen actually influences the vascular and lymphatic permeability. And so through life phases like puberty, pregnancy, perimenopause, and menopause. And so with a lot of my female patients, they would say, man, after I had my cycle, I ended up my body started changing. I was trying to lose weight and I couldn't. That is a form of secondary acquired lymphedema because of the changes. Unfortunately, the women that are able to become pregnant and became pregnant, that huge change that you go through during your pregnancy through those 9, 10 months, whenever you're carrying full term, is a lot of stress on the body. And those hormones have a roller coaster effect on the body. And there are sometimes that some women they end up having swelling in their inguinal lymph nodes, which is pretty much in your around your pelvic area from the baby sitting and settling in that area, along with the hormonal changes. That no matter what they do, they can't get rid of that little pouch area, or end up having swelling going into their legs and upper thighs. And so it has multiple effects. And unfortunately, for our patients that have any type of cancer involvement, usually when it comes to the axillary area, our armpit area, when it comes to breast cancer, they usually have to take out the tissues, and they always, not always, but they usually 90% of the time always take out and test the adjacent lymph nodes. And so when you take out the lymphatic, a piece of the lymphatic system, it makes the whole system work harder to move the fluid throughout the entire body. And so that's where it usually occurs. And it's kind of unfortunate to say, sometimes the cancer doesn't cause lymphedema, sometimes it's surgery because they did what they
Wow.
need to do to. Yes, and it's unfortunate that some oncologists or breast surgeons, breast reconstruction surgeons, they're like, I saved your life. Thank you. Appreciate it. You took the cancer out, but the surgery caused the lymphedema because now my system is overworked and now it's damaged because of the surgery. And then they come and see me. And so um, that is one of the main things. It's like, "Oh, I got cancer, so I'm gonna automatically get lymphedema." There's 25% of the population when it comes to breast cancer that actually don't get lymphedema within the first, um, year 1 to year 5. But depending on the type of surgery that they had, the amount of lymph nodes that were taken out, that is when that in instances of lymphedema increases exponentially.
Okay.
Mhm.
Who does lymphedema affect?
Everybody. It can affect everybody, but it mostly affects women. Men, I do have some men that are on my caseload that end up having lymphedema because of prostate cancer or inflammation of the prostate that clogs up that small area that have some of the pelvic lymph nodes in that area. But there are kids that are born with it. That's called Malroy's disease, where they were already born with a malformed lymphatic system. And so, yeah, I can honestly say everybody.
Okay. How often is lymphedema misdiagnosed or overlooked?
Very often. Takes literally takes a village, and it takes professionals, like myself to go out and advocate not just to the oncologists, and vascular doctors, because those particular professions are usually on board or are aware of lymphedema, but it's really like our primary care and internists that don't quite see it. They see patients as, "Oh, you just are," I hate to say the word, but overweight or fat, and, you just need to lose weight, you need to walk more, and then we'll put you on this diuretic, and then you should reduce the size of your limb, and that's not the case. They need actual help. So it is chronically overlooked. And underdiagnosed and seen as obesity, seen as they need a bariatric surgery to help reduce some of their the limb volume. Sometimes that can help, but the lymphedema is still there. Sometimes it's seen as um, chronic wounds. Diabetes is like, oh, you're just swollen because you're eating too much carbs or you're eating the wrong stuff. And I've seen patients that will totally change their entire diet, do total liquid diets, drink their water, all this stuff, and they still wouldn't lose the weight that they needed to lose. So definitely chronically underdiagnosed and overlooked, unfortunately.
Wow. I can't
Mhm.
imagine getting a surgery like bariatric surgery, and that wasn't the cause of what was going on with me.
Yes, yes. And you can
Wow.
lose some weight. Weight definitely is always a factor, but it's not the all leading cause. And I hate when health professionals just stick to that, oh, lose weight and everything will get better. Not necessarily.
Is it genetic, preventable, or both?
It is it can be preventable, but it definitely has a genetic component. There is a hereditary component that usually happens. It's usually passed down from the maternal gene. So the matriarchs of the family usually have it. If your mother had it, then most likely you would have it. If you have a sister, then most likely your sister would have it, and then on down the line. And I think that when it comes to preventable, it can be to a certain extent, but honestly, anything could trigger it. I've had a patient that very active. She was actually born with it. When we find out when we went down her medical history, but she was a hiker. She went out and she got bit by a tick on her lower limb, and then her limb just swelled up. Never had any issues, never had any other instances of swelling, but that particular parasite or that bite helped just whatever was going on with her system was already overworked while she was just doing her thing, staying active, doing everything she was supposed to do. But that one tick bite triggered her lymphedema, and now she has to wear compression for the rest of her life just for doing that. And so it's kind of hard to say when it's preventable. I like to say more manageable because anything could happen. There was an instance where a patient had breast cancer and she stayed in the States. She had her surgery. She didn't have any issues, no residuals of lymphedema. Her and her husband wanted to go out of the country to for the first time, fly a plane for the first time in 20 years for their 20-year anniversary. She beat cancer. She's doing great. Soon as she got up in the air, the arm that the breast cancer was, and when she had the surgery, ended up swelling up, and she ended up having lymphedema after that. And so it's one of those things of it can happen at any given time. When it does happen, it can be more so manageable. But yes, genetic, there's always a genetic component. And preventable, we can do things to try to prevent it, but if it happens, it can be more manageable. Hope that answers your question.
Yes, it did.
Mhm.
I'm just amazed that, like you said, it could happen at any time. The lady just
Yes.
flying and the one who was hiking from a tick bite.
Yes.
Usually from a
Yes.
tick bite, you think just Lyme's
Lyme
disease, not
disease.
something, not
And she didn't get Lyme
lymphedema.
disease. That's the interesting thing. It wasn't like a total overload to the system. From what I understand, she did not get any Lyme disease. It was just that bite in that particular time at the particular place, and her system just was like, "All right, I'm done," and just overload and caused that chronic swelling in her limb.
When should someone push for a second opinion?
As soon as they feel like they're not being heard. Lot of a lot of my patients end up working with surgeons that say, "Hey, I saved your life. You're good to go now. Your cancer's gone." And say, "Yeah, but my arm is heavier. I'm having pain. I'm having a hard time lifting it. Hey, my body's changing. I don't like how one side is bigger than the other. What should I do?" And then sometimes they say, "Okay, you need to go to a professional that, I've seen this before. Let's get you checked out." And sometimes they say, "But you don't have cancer anymore." And so as soon as you feel like your symptoms are affecting any part of your life, you need to go see somebody that may know something that could help you. It's unfortunate that it shouldn't have to be one thing other than one thing overrides the other. Yes, thank you for saving my life. However, this is also affecting my quality of life. So anytime you're not heard, please ask somebody else.
Have to advocate for yourself. I'm just amazed at the information that you're giving. Like, I'm like, wow, I didn't know about it could just happen living everyday life and to have a surgeon say to you, I saved your life from cancer, like you should be grateful that I have a side effect from it.
Yes. Yes, this is
That's
not the
wow.
worst that I've heard.
I'm just
Believe me, it's like, "This is not the worst thing that's ever happened to anybody." It's like, "You don't have cancer anymore. I'll see you in 6 months," and that's it. And I've it's disheartening.
wow. Well, advocating for yourself in the medical field is a whole nother conversation in itself.
Yes, yes, it is. Yes, it is. We can talk about it.
Yeah. What made you passionate about working with lymphedema patients?
So, I am a daughter of a breast cancer survivor. My mom, Linda Polite, she got breast cancer. She was 21 years old, and then she had me when she was 24, 25ish, and then my brother 4 years later. And so I didn't see. She did a really great job with kind of keeping it to herself between her and my dad. And so once I got older, I started to notice like different things are changing in my body that, when I hit puberty, it's like, huh, my arms never quite filled out correctly. Like I would work out, I would do things, but they will always stay the same shape. And once I start learning about lymphedema and learning that I can do something to fix it, at least I say fix it, at least to help out the patient because I didn't know anything about it. That's when I really, really got passionate about it. And just seeing that it's a very hands-on type of therapy. You do the manual lymph massage, you do the compression, you measure, and the work that you do on the entire body, not just the limb, you can see a difference within one session. Sometimes it takes more sessions. Most times it does take the consistency of that, but the patient can feel a difference after one session. If done correctly, they feel their limb is a lot lighter. They feel like, oh, I can use the bathroom now. Once I use the bathroom, I can get this excess fluid off my system. And so that's what really like drawn me to it. That it was one of the therapies that you can see a either delayed or instant, gratification of the work that you've done with the patient. And so seeing that change and seeing them get educated and then be able to manage to get them from wrapping with compression wraps to getting them to a compression garment to getting them to, okay, hey, I'm able to move more. Hey, I'm no longer walking with a walker. I'm using a cane now. I'm more mobile because I have less fluid in my leg. So now I can go play with my grandkids. I can go take a little bit longer walks on the beach like I used to. But before it was like I could barely lift my leg just to put my shoe on. And so seeing that change and that gradual difference was a huge thing for me when increasing patients' quality of life.
What does a typical day look for someone who is managing lymphedema?
So it definitely varies, but for the most part, it is getting up in the morning is a struggle. Their limb is very heavy. So I was talking in a sense of lower extremity lymphedema. They have to get up, they have to clean the limb because if their limb is so large that they have folds on their legs, they have to make sure that they clean it, keep underneath the folds to keep any type of infection from happening because they're at a higher risk for cellulitis. So you know how if you're in the middle of the night and you hit your small pinky toe on the edge of the
Mhm.
bed and you half asleep, you know, that's just like, "Ow, that hurts. I can go lay down, it's fine." But for a person with lymphedema, that can be a trip to the hospital, and that could be at least 3 to 5 days of IV antibiotics, and fluids because any dent, ding, damage to the tissues could open up and cause a wound, and because the lymphatic system, which is part of our immune system, could override and overload, and it immediately can turn into a cellulitis or, MRSA infection that can send them to the hospital. And so being very mindful, they have to always stay covered. They're always thinking about not just how they feel, but how they look. When your body is not proportionate because how heavy the limb is, you don't wear the clothes that you used to wear that you were able to wear that you want to wear. You usually, wear larger clothes. If the patient does have access to the garments and the compression wraps, they have to put that on themselves, learn how to put that on themselves. If they're by themselves, they would have to have family members to help them. And so it just takes a lot. A lot of the things that my patients talk about too is just getting out into the world. if they have a large limb, one side is bigger than the other, and they do have compression wraps, most people look like it looks like a cast or it looks like a big ace bandage. Looks like, you maybe had a burn or something. And so when they're just going to the marketplace or going to the store, you got people staring at them. You got people saying, "Oh, what's wrong? Did somebody, did you fall and break something? Are you okay?" And having to explain yourself over and over again. Some of my patients end up having weeping is a lymphoria, which that the skin is so full of lymph fluid that it can't move. It just comes out of the skin. It looks like the skin is crying and is literally
Wow.
leaking and pushing out wind fluid, leaking fluid. And so they end up having to keep cleaning themselves. There are some patients that will leave a trail of fluid behind them without them knowing because they might have accidentally hit the side of their leg or their lymphadenous limb. It's a lot. There's a certain smell that may come with it because of the lymph fluid. And so it's very isolating. It can be very isolating if they don't feel confident or comfortable in their care, if they're not able to manage it themselves, they just stay home, unfortunately.
Mm,
And so it can be very isolating. They go to their doctor's office because if you're able to, if insurance covers it, and if you have the transportation, you usually see a specialist like me at least 2 or 3 times a week for at least 6 weeks, sometimes 8 weeks. And depending on how severe their lymph fluid is, their lymphedema is, it could be months. I've seen patients for or a couple of years just to help manage their lymph fluid, just to help them. And so, takes lots of time, lots of just pressure to get up in the morning and to get past the fact that they don't have a normal life. They have to always think about
right.
their limb, how their limb affects the way that they move, the way that they do stuff, the way that they look.
Can stress make the symptoms worse?
Yes, yes. Increase when you have stress, you increase your cortisol levels, which increases your inflammatory markers and your inflammatory levels. And when you're inflamed, you are more likely to have an increased permeability of fluid go through the tissues because now your body is in this always fight or flight mode and is constantly putting those
Mhm.
things out there, making you swell more. So, yes.
How do you help your patients cope emotionally with a chronic condition?
Yes. I talk to them just like, okay, like how you asked me, what does your day look like? What is something that you think you could change with this? What can we do to make one aspect of your life better? And sometimes it is just listening to the fact that, hey, I'm hurting, I'm tired, I don't like the way I look. Let's find a way to do this. There are some I've had patients, I had a conversation with patients like, hey, let the genes go. If you are chronically inflamed and your lower left leg is swollen, and you keep trying to put jeans on or sweats on just to show that I can do this or this is what I was wearing, I was able to just talk with one of my female patients like, hey, start wearing gaucho pants, those hammer time pants. I would do this, start, changing your wardrobe, going and get you something different that you are more comfortable in. Now, if you want to wear that, that's fine. But if it's bothering you, find a way to work around it. I sent her like pictures and videos like flowy dresses to wear that you could, wear during the summertime. Here, you could wear your compression garments underneath here, still look nice, do things. So just doing thinking about the change of clothes, your garments, what you can do to help you feel better. Yes, that leg is still there, but how can we literally address it to help you, deal with your quality of life? But literally it's just listening to them and saying, okay, what are some things that you can do? Sometimes just saying, hey, you have a hard time getting up in the morning to get here because of the heaviness of the limb and along with their other comorbidities. Sometimes like, okay, schedule your appointments 10 o'clock and beyond. I'll see. I can make sure I lock in, these are the days that I have like some 10 o'clocks for the next couple weeks, 10 and beyond. Let's do that. If it's hard for you to get up at 8 o'clock in the morning because it takes time for you to get up, to clean yourself, to wash yourself, to get your clothes because that limb is so heavy. Let's do this. So saying, okay, this is what your schedule needs to look like. Let everybody know that I can be on I-10 by 10. That's fine. Work, build your way, build yourself up trying to, because this is life changing. So you got to change your life according. So just having that conversation with them.
I'm sorry, I thought you were finished. I said, "I can't believe you told your clients to wear some hammer time pants."
And she did. She found some from Goodwill. She sure did. I mean, because it's like if make the adjustment. Let's see what we can do. I sure did.
Right.
But my patients love me and I love them too. So I just be talking to them and just be real talk. They'd be like, hey, let's go here, let's do this. Because these are real life situations, you know?
Yeah, yeah. But aren't the barrel style jeans now, aren't they, like, more like hammer time pants?
Yes.
They're like
Yes.
a
They don't
little
have to go
wider
with the
too
time.
than the wide legs.
Mhm. Yes, they are. The wide
Okay.
leg we call them I used to call them elephant pants, the really wide leg pants that kinda come out here. I love them. I love them myself, you know?
Yes.
And so just making that adjustment is like, "Oh, you know what? I don't have to sit here and struggle to put on jeans that used to fit me before my leg got swollen." But at the same time, being sensitive to that, it's like, are you able to do that? Here are some are you able to make some adjustments? We do you have a friend who's a seamstress? Can we where do we need to go? I'm not just say, oh yeah, go to the mall and get you something like this. We actually go over like that's sometimes part of my sessions, like, okay, what is it within your budget? What can we do? Where can we go that may have some type of clothes like this? One of my favorite things I
Right.
do go to Shein, haul, get you some long dresses, get you some of those pants, those colorful high leg pants, 4 for $20, man, and just
Yes.
rotate them bad boys and just take it from there.
Yes. We love Shein.
Shein.
You talked about and mentioned, some treatment and management. So, where can the
Yes.
listener start at home if they have this chronic disease?
So there are plenty of resources that are online, especially on YouTube. But I would honestly want you to go get seen by a certified lymphedema therapist. At least get your first initial evaluation or assessment, so they can get you in the right track. Main thing is compression to do that. But the thing is, a lot of people will have compression, but it's not the right compression. There are some those socks and stuff that we get, from Walmart for $15 that may not be the thing that you need. If you were to even get some off of Amazon, that's not a terrible thing, but you got to make sure it's fit properly because a lot of these quickly, mainstream compression garments are one size fits all. But having a lymphedema therapist able to actually measure you and get the proper garment, because you may need the Velcro wraps that wrap around. You may need more of a large calf. Your leg may not fit the norm shape, so you may need something custom. So I really would urge your listeners to go find a certified lymphedema therapist that's able to do a full assessment and give you all the information that you need. But as far as at home management, we all talk about, drinking your water, great, but moving is very important. Even if you're sitting down and you're doing seated exercises, marching in place, pumping your ankles for your lower extremity. For here, doing diaphragmatic breathing is helpful for the upper and the lower extremity. So when I say diaphragmatic breathing, belly breathing, to help with the internal pump along with your diaphragm and with the thoracic duct that goes right here in the middle, very helpful. Even just doing little arm circles going up, doing here just to get that muscle pump moving because the lymphatic system doesn't really move on its own. It actually moves with the movement of your body. So that's why when our patients get sedentary because of the swelling of the limb and they just kind of sit because everything is so heavy and they're so tired all the time, it gets worse because nothing is helping move that lymph fluid. So that's what I would honestly
Okay.
say. Please get checked out by a certified lymphedema therapist first before you decide to do any treatment.
And I would have never thought, like you just mentioned, getting measured for the compression, that would be important.
Yes, yes, getting the right stuff. Because
No, go ahead. No, go ahead. I want you to finish.
you wouldn't want to go to like bra measurement. You can kind of eye it,
Mhm.
but you would want somebody to say, okay, no, you're actually this size. No, you're the bandwidth here. You probably need this cup size because you don't want to come out. Worst thing is coming out the store and you bought some of this tight bra. Ain't nobody got time for that. But answer your question.
That is so true. You do not want a tight bra.
Right.
How important is consistency with compression?
Very important. You should be compressed every day. It is a long-term and lifelong commitment to wear the right compression and to be compressed every day, especially when you're traveling. I would say if you can't do it every day, if you're on the road for more than 30 minutes sitting down in the car, wear compression. If you are flying, riding a train, bicycle, whatever, wear compression. And it's every single day. So that's why getting the right size compression is very important, because if you wear it every day, it needs to be comfortable. Because the first thing that when it comes to compliance, if they don't wear their compression, first thing I think, is it comfortable? Is it cutting off circulation? Is it itchy? Is it not the right material? Does it keep sliding off? Once it becomes inconvenient, compliance goes down. So that's why it's very important to wear compression. So compression consistency is very important.
Are there any new or emerging treatments people should know about?
So I will say when it comes to lymphedema, it is all about the management, but there are some, it's called the venogram, and it's a decompression. So basically, if you do have lymphedema, say of your lower extremity, right, you can go to a vein specialist and they go through and do a stent in your iliac vein, which goes along the inguinal line, your pelvic area, and it helps dilate and open that up to help drain everything better, because the lymphatic system likes to run along the lines with the venous system. And so if there is a over a 50% blockage, then they would actually put a stent in there, open it up, and then allow drainage. Now, I've seen this happen where a patient lost over 10 inches around her lower leg with lymphedema after this treatment in 2 weeks. However, because she has a history, because it's all depending on your comorbidities, because they may have a history of chronic kidney disease or diabetes, it can easily come back up and swell back up. So that's why it's very hard to do any like new stuff to kind of like completely drain it, because that
Mhm.
lymph fluid is always going to find a way to get back into the tissues and recollect. Now, it all depends on everybody, but there are certain people that don't qualify for it. If you're at stage 2 kidney disease, you do not qualify for that particular exam or procedure, because the dye would be too much on your kidneys. And so
Okay.
knowing your patient's history is very important, because you can do that. Oh yeah, you can go into they get that drain, but then it's like, oh wait, you got stage 3 kidney disease. You can't do that. And so, yeah, they have some different things that they like debulking. There are some surgeons that are doing like water assisted, kind of like liposuction around the area, but they have to be very mindful, because, you want to find the right person to do that, to really be mindful of the lymphatic system versus just going in there, because it can cause more damage if they're not careful or qualified to do so. Red light therapy is helpful to help with the inflammation. It's not a be all cure. It's definitely help in conjunction with manual lymph drainage, compression, skin care, and exercise, but it can be a help. But again, if you have a history of any type of cancer or radiation to the area, then you do not qualify for that, because red light therapy or even blue light therapy can actually reburn the skin if you have those radioactive deposits still in the tissues that can be activated by any type of radiation. And that can even come from the sun as well. So that's why it's important for you to talk to a lymphedema therapist, so they can tell you what can be helpful, what cannot be helpful, things like that.
Okay. Well,
Sorry.
thank you for that. No, thank you for that information. I'm learning things as well. To get into our next topic of discussion today, the pelvic floor dysfunction. Can you explain what is it and who it affects?
So, when it comes to pelvic floor again can affect dysfunction, can affect anyone, male or female, and um, it's so many things. It's kind of hard to kind of pinpoint it. But pelvic floor dysfunction can come from, again, hereditary birth, how you are born. People that have scoliosis have a more higher instances of pelvic floor dysfunction, because if their spine is off kilter and then their pelvic bone is off kilter, then that means the muscles, there are 16 muscles down there. That means that they can be taut on one side and lax on the other side. So kind of knowing that there are patients that have any type of connective tissue issues. I'm starting to get more patients that have EDS, which is Ehlers-Danlos syndrome, and it makes the connective tissue around your body more lax. So these patients usually have more instances of prolapse, because the ligaments and the pelvic organs are not as tight and tacked to where they're supposed to be. And so they're easily able to drop through the vaginal canal. Patients that have really tight pelvic muscles, patients that had surgery, patients that had babies, whether it be um, uh, vaginal or C-section. It can affect any and everybody, to be honest. I've had some pediatric patients as well that had issues with their bladder and using the bathroom and having bowel movements because of histories of Crohn's disease, developmental issues, things like that. So it can affect everybody. Long story.
Wow. I thought it just was mostly women. So I learned something as well.
Hmm.
How common is pelvic floor dysfunction really?
Extremely common. One of the things that I say is like it's something that's normal. It's normalized, but it should not be normal. A lot of my women that have issues with, sneezing or when pee when they sneeze, jump, laugh, especially after having a baby, it's like, oh, that just happened. That's just what happens with women. We just have a no, that's not normal, girl. We can fix that. And so you'll be surprised just saying like how people have just accepted the fact that I guess sex is supposed to hurt all the time or sometimes, or I'm always going to have issues on my period, or I'm always going to have issues with, for men, ejaculation or holding my bowels, or I'm just going to have issues with peeing myself after having kids. It just comes with the territory. No, there are things that you can do to help fix that. Non-surgical things, and then some people do need that extra intervention, that extra surgical intervention to help that to increase their quality of life.
What is the difference between a weak pelvic floor and a tight pelvic floor?
They can be separate and then they can be together at the same time. So you can have a weak and tight pelvic floor. The weakness comes from the inability of the pelvic floor muscles to be able to relax and then contract when it's supposed to. Whenever you have a weak pelvic floor, it is considered that it's not activating the way it's supposed to. It's not reacting at the time where you need it to. And then a tight pelvic floor is just mean it's just staying closed like this. So you think of the pelvic floor as like a open, like a U, like the Miami U. And so whenever it contracts like this to close up the orifices, and then whenever it relaxes, it opens back up. So whenever you have a tight pelvic floor and it stays tight, you can still have leakage even though you have a tight pelvic floor because the muscles are just staying tight and are not being able to move. So anything can come through. It may take a little bit longer and it may sit in that canal for a little bit longer because of the tightness of the pelvic floor, but it still will get its way through because you're not able to relax it and contract it the way it's supposed to be. So you can have weak and or tight pelvic floor. That makes sense. So
Mhm.
they can come together or they can come separately.
Why do so many women normalize leakage, pain, and or think it's just a part of aging?
Because the healthcare professionals that we go to tell us that it's normal, and that's unacceptable. They tell us, "Oh, well, that just happens when you have a kid," or, "Oh, that just happens at the time. Oh, well, just here's some moisturizer, here's some estrogen cream, you'll be fine," without explaining what's going on. And it's also a very intimate space as well. I love the one thing I love about social media is that it allows us to talk about things that we thought only affected us. And it's like, "Oh my God, that's crazy.
Mhm.
We have the same experience." And so I think it's great that people are saying, "Hey, this is what's happening, but this is not, this is not acceptable. Something can be done about it." But unfortunately, there's still shame around not having a functional pelvic floor or functional pelvic organ. And it's just like, okay, well, I guess this is just my life now. I guess I'm just going to wear pads for the rest of my life. I guess I'm not going to be able to enjoy sexual interaction. It just comes with territory. I'm glad I had fun back in my 20s, but I guess my 40s and 50s and 60s, I'm just gonna have to just live with this, and that's not the case.
Well, that leads me to my next question. So what would you tell someone who feels embarrassed to seek help?
I tell them the first thing because I've been asked this multiple times. It's like, "Am I the only one that you've seen this? Has anybody else dealt with this?" It's like, "Yes, you are not the only one, and I've worked with people like you, and there is light at the end of the tunnel." Talking to somebody that you feel comfortable with. As a pelvic health therapist, and I feel like me as a clinician, there is no TMI, but I had to make sure that I was comfortable with whatever somebody had to tell me that, when it came to that particular realm of therapy, of conversation, that I make them feel comfortable immediately. I try to at least make them feel comfortable immediately. So finding a therapist that you feel comfortable with is definitely one of the first steps. and you feeling comfortable with that too. Sometimes writing it down can be very helpful. I've read notes from patients like, if you don't want to say it out loud, here's a pen and paper, write it down. And then I can respond to you either voice or I can write it down as well. I've done that as well because some people just feel very uncomfortable, but recognize and realize that is everybody has one. Everybody has a pelvic floor, but
Mhm.
not everybody knows what to do with it when it's not functioning correctly, or even if it is functioning correctly, some people just don't know what to do with it. And so it is a finding that space, whatever you feel comfortable telling. And so there are times where, some patients feel comfortable telling me a lot of stuff, how they feel, in the initial eval. And sometimes it takes a couple sessions. It's like, hey, I meant to ask you about this, but now I feel comfortable telling you about this. This is my experience. This is what happened, and take it from there.
Right. What are some of the symptoms and causes of pelvic floor dysfunction?
So many things. Let's see. Like I talked to you about, for the women, childbirth. Unfortunately, there are certain cancers, so uterine, cervical, even PCOS, endometriosis, and adenomyosis as well causes discomfort and dysfunction in the pelvic floor. For my men, prostate cancer. I usually see that's usually the main culprit is an enlarged prostate or prostate cancer. Either they had radiation or chemotherapy to the area, had the prostate completely removed, and they end up having leakage. There's some people that have just gallbladder issues um, that I was able to figure out. I was like, hey, you have gallbladder, you have a hernia. A hernia is an opening here that messes with your inter-abdominal pressure, which causes more pressure at your pelvic floor muscles, but pelvic organs that could cause leakage and pain as well. And so it's so many different things. I had a few patients that have found out like, hey, your gallbladder might be diseased. That's why you're having issues with fecal incontinence, and getting them to the right place and getting them to a gastroenterologist like, "Yep, you're right. Get the gallbladder taken out." Boom, symptoms have gotten better. So it's so many different things, even with your eating, how you eat. And some people have ingest too much air because they're always chewing gum, and they end up having trapped gas here in the area of the diaphragm and end up having too much pressure. It's so many different things. You having a knee injury could cause leakage. Having a hip replacement can cause leakage because one side is um, uh, shorter than the other because of the hip or knee replacement. It causes dysfunction here in the pelvic, not just in the pelvic joint, but in the pelvic bone, and that causes leakage and causes shifted of the pelvic organs, which causes leakage. So there are some patients that where I would just give them a shoe insert in one of their legs that are shorter than the other because of a surgery or because of how they were born, and that leakage has stopped.
Wow.
Yeah,
My mouth was open when you were
I
explaining
know.
it because I was like, a knee replacement in your hip?
Yes, yes, yes.
Wow. When should someone see a pelvic floor specialist?
I would say as soon as as soon as those symptoms happen and as soon as those symptoms are affecting your daily life. I've done things too, like for even if you are pregnant, I've done like kind of like a prophylactic type of therapies where I had pregnant patients that didn't really have too much leakage and have too much back pain, but we went over labor positions. We went over like actually stretching the perineum because they wanted to have natural births. So help preventing them from having tears, perineal tears is very important. So anytime you feel like something in your life could affect your pelvic floor and is affecting your pelvic floor, get a pelvic floor therapist consultation.
Okay. What are some treatments and how long does therapy typically take?
So, of course, like everybody, it all depends. In occupational therapy, it depends. So, it depends on what they're able to do, what they're in, and how their symptoms present. I've seen patients that just needed help with having a conversation with changing their diet, saying, "Hey, are you doing a lot of keto? Okay, cool. We need to add some fiber into that. You need to increase your water intake. Make sure you're doing a diaphragmatic breathing when you're doing your squats," and I've seen them maybe 1 or 2 times, and their symptoms have gotten better. I've had patients that, unfortunately are chronic pelvic pain patients with endometriosis, adenomyosis, had, injections in their pelvic floor because of the tightness, and I've seen them for over 6 months to try to relieve some of their symptoms. But pelvic floor dysfunction looks like pain during sex, leakage of the bowel, urine, pelvic floor heaviness. You feel like uh, prolapse. You feel like you wipe yourself and you feel like a ball of tissue, coming out of your vaginal canal or rectum. Sometimes even hip pain, lower back pain that can be connected to the pelvic floor. It's a whole myriad of things. There are a few people that just have issues with constipation and diarrhea as well that I also work with them about. It's a mixture of different exercises, different stretches, cation, diet changes. Sometimes I use a TENS unit, which is electrostimulation, to the visceral areas or to the areas or the sacral nerves, which is like in your lower back area, to help with that brain bladder connection. I've done a multitude of things with some patients. I've seen them and I looked at them. I did their initial evaluation, got their medical records, and saw what they had and see what was happening. It's like you need to go to surgery as soon as possible. So it definitely all depends. But sometimes they just needed that. They just needed that second set of eyes because they probably have already been to urology or to gastro or their women's health professional or their family medicine professional. They just needed somebody else to say, "Hey, this is bad. You might need to go in and do this." And I have a great relationship with the current urogynecology doctor that I work with, and it's like what I say is meaningful, and they move forward with after my assessment. It was like, "Hey, Tiana, I'm seeing this, but I want you to assess them and see what we need to do and take it from there." So once you build that relationship with other specialists and professionals, it makes it a lot easier for you to go and advocate for your patient. So
Wow. Well, that's great for, your patients, especially the ones who may be seeing those type of specialists that you have that, close connection to them.
mhm.
Is it ever too late to improve symptoms?
No, I love working with my older patients that are they had their kid at 21 and they're 71 and that 50-year-old kid is still giving them pelvic problems. And I love telling them it's like, "I got you. I know you 50 years postpartum, but you can get this thing." Yes. Oh, yeah. I absolutely love it. Yes. There is no age. I think the only time it is too late when you don't ask, to be honest. But I've seen patients young, older, and seen their symptoms get much better because nobody ever told them. Like you said before, it's just been taught. Well, I guess you just leak after you have a kid, and I guess you can't get on trampolines after you have a kid, and there's no more roller coasters because my insides are flipped upside down after I had a child. And so there are so many things, but it's never too late to get pelvic floor therapy. I see patients from the youngest I've seen was 70, the youngest was 7, and the oldest was 9. So yeah, everybody can benefit.
Wow. How are lymphatic health and pelvic health connected, if at all?
Yes, you have sorry, we'll bring it back. You have pelvic lymph nodes that are deep and superficial. Inguinal is more of the superficial, and then the pelvic lymph nodes that are in the gonads. And gonads are your sex organs, your ovaries, uterus, and even in your colon area. And then gonad area in the male is around the prostate and within their scrotum as well. And so when you have any type of injury to that area, whether it be radiation, surgery, sometimes I think I may have had a patient back in the day that had a motorcycle injury, end up having like a crush fracture in their pelvic area, and they end up having swelling like here, like a tire of fluid that would just sit and settle because the bone fragments just severed the lymph vessels and tore up the lymph nodes that they had to take out. And so now that lymph fluid doesn't have any place to go if it's not being redirected. And so there definitely is some correlation. It's most times it has to have some type of effect in the area. So my PCOS girlies, my endoadenomyosis that are chronically inflamed in that area that cause pressure on the inguinal lymph nodes and in the deeper pelvic nodes because their pelvic organ, their bladder and their uterus is denser because of the scar tissue of the endometriosis and adenomyosis and is causing pressure in that area that can cause pelvic congestion and causing a lot of swelling that they just can't get rid of. So Yeah.
What does body literacy mean to you?
Body literacy literally means like learning, understanding your own body, knowing what's there and what's not. In my clinic, I have a big picture of the pelvic floor musculature on my door. And you will be surprised, young, old, people that's had kids, people that's, you know, maybe didn't have kids, but just been living a long time, didn't know where the urethra was, didn't know that the urethra and the clitoris were maybe in close contact, but they're not the same thing. And so understanding your body and understanding, okay, what is supposed to be functioning, what does normal look like and what does dysfunction look like is very important. And just breaking it down to the simple, breaking it down to the ABCs. This is where this is where that is, this is where this is supposed to be, this is what's supposed to happen. This is what you're supposed to feel when this happens, but this is not happening because of XYZ. Breaking it down to a person's understanding of so they can be more educated and be more comfortable in the body that they're in, that they can make changes, that things can happen, things can get better. So that's what body literacy to me. Just really educating yourself at whatever the patient's or the client's ability of understanding.
What is something that you wish OBGYNs talked about more?
I wish they would talk about pelvic pain more and validating people's experiences, that it's not always cookie cutter, and just really listen to what the women are what the women are saying and what they're going through. I think that like for me, I went through multiple doctors and multiple pelvic ultrasounds to get to where I am now with my own diagnosis of endometriosis. And now I also found I have adenomyosis as well. Because I listened to my patient. It's like they're talking, I'm like, girl, man, you got the same symptoms. Me put in this referral and do that. So I think that I really wish that OBGYNs will be able to just continue. I know they're doing a great job, and especially with the influx of people that they're getting. I know it can be a lot, but really hone in time and take the time to listen and educate their patient and listen to their feelings and validate. Don't make them seem like if they're not something that's urgent and emergent, that it's not important. Just because you're not hemorrhaging, just because you're not pregnant and the baby is coming out the canal, doesn't mean that it's less important.
Right.
Mhm.
Well, as we wrap up today's conversation, I hope one thing feels clear. Your body is not broken, it's communicating. Whether it's swelling you've been ignoring, leakage you've been embarrassed about, or pain you thought was just part of getting older, you deserve answers. You deserve support. And you deserve to feel strong and informed about in your own body. I hope that you enjoyed episode 3 of season 3. And I would like to thank our guest, Dr. Tiana Polite Brown, for coming to the show. I learned a lot. And I just want to say that when this episode comes out, I know you talked about that the topics we talked about do affect men, but when this
Mhm.
episode comes out, it will be the beginning of Women's Month. So I
Yeah.
just feel that this is very informative for women. But can you please share with the listeners of where they can find you?
Yes, just to for my professional website, because I'm a military wife and I kind of go in and everywhere. I'm currently right now at this time in Dover, Delaware, and I am currently at Bay Health Sussex campus in Milford. But if you need to know where I'm at or what I'm doing, please follow my professional page, Dynamic Occupational Therapy Services. My professional webpage is www.dynamicotservices.com. That is where all my credentials are. That's where I do most of my updates. And then also follow me on Facebook and Instagram as well at Dynamic OT Services and any of those handles.
Okay, and I'll definitely have that information in the notes for the show. If this episode helped you, share it with another woman or man who needs to
Mhm.
hear it. I
Mhm.
am your host, Stacy C. Please do not forget to subscribe, share, like, and comment, and make time to see you grow, girl.
Thank you so much. Grateful to be a part of the show. You have a beautiful rest of your day.
Thank you.